Thank you, Mr. President. Operator, we have time for one more from the world out there.
Your next question comes from Dennis Yurka from Las Vegas, Nevada. Dennis, please go ahead and ask your question.
Mr. President.
Hi, Dennis.
How are you, sir?
Good.
I am a retiree who's a member of the International Union of Painters and Allied Trades who is currently drawing my health insurance from COBRA. Since a federal subsidy from my employer is in danger of being discontinued, and I have confirmed my former employer will not offer COBRA if the subsidy is discontinued, what am I supposed to do, and how does the new health care law help me now to get health care, especially since my wife is dealing with some very serious health issues?
Dennis, can I just ask you, so you don't yet qualify for Medicare. You're getting COBRA because your employer is not, you're not on the job right now. Is that what's going on?
Correct.
Okay. Well, here's what happened, is because of just this terrible recession that we had, we knew that a lot of folks were going to be losing their jobs. I mean, when I took office, 750,000 people per month were losing their jobs. We're now, because of the Recovery Act, the great work that Congress did, we're now gaining jobs again every month. But we had that 8 million job hole that was created because of the recession, and that's going to take some time to fill. So you've got a lot of people like Dennis out there, people in construction, people in the trades, a lot of folks who were laid off, who not only are struggling to pay their bills, but they were in danger of losing their health care because they got it through the job. Now, there's been a program around for a long time called COBRA. Some of you know about it. The idea is that you're, by law, allowed to keep your health insurance even if you lose your job just by paying the premiums. Here's the catch, though. If the premiums are $1,000 a month, you weren't paying those. Now you've lost your job, so you've got even less money. A lot of people couldn't afford COBRA. So one of the most important things we did in the Recovery Act, and a lot of people don't realize this, but this was hugely important to so many Americans, including Dennis, as you just heard, was through the Recovery Act we said that we are going to subsidize 65% of the costs of what your premiums were so that you can keep your health insurance even as you're looking for a job and trying to get back on your feet. So if your premium for your family was $1,000 a month, now it only costs you $350 a month. We have sustained that for 1.5 years now, and we think it's important to sustain it for at least another 6 months because there's still a lot of folks who are out of work. The economy is improving, but the unemployment rate is still high. This is being debated in Congress right now. And so, Dennis, the answer is, what we need is to make sure that Congress follows through on its commitment to go ahead and maintain COBRA until people are working at a higher rate again.